surgery is limited to few things which we call as red flag signs. Whenever you have some neck pain which is radiating to your arms or to your legs, causing any numbness or weakness, any low back pain radiating to arms and legs, where the patient is unable to walk, there is no steady gait. That is when I say gait. The walking pattern is altered and there is loss of control of the urine or the motion that he or she passes. When a patient presents with such symptoms, then we'll have to think into something beyond that. Okay, there is something happening significantly. There could be anything. If there is an infection in the spine, we are in a developing nation wherein tuberculosis, which is a most common bacterial infection in the spine, and you have other bacterial or fungal infections that can also happen in the spine. So we like to look into that angle. That is one aspect. The second aspect is anybody who has a degenerative condition, that is a significant wear and tear that happens in the bone. Any degeneration or wearing out of the disc causes the bone to press on the adjacent bone. And sometimes what happens is there can also be a slip of the bone, which we call it a spondylolisthesis. So these are conditions that would warrant surgery. So any infection, any sort of instability, which is causing pain in the lower back or in the neck, should be warranted for a surgery. Apart from that, what else can we think of? Any tumors in the spine. So these are conditions which would definitely warrant a surgery. Apart from that, we have another condition wherein we call as deformities. When we talk about deformities in children, the most common deformities that we encounter is scoliosis. When I say scoliosis, it is an S-shaped deformity that happens in a child. So it can be congenital, which can be from birth. The most commonest type is idiopathic. When I say idiopathic, the cause is not known. Almost 80 to 85% of the time, it is not known. And during the growth spurt, the deformity that we have seen significantly increases in intensity, and that's when, it warrants a surgery. Any deformity or any curvature beyond 45 to 50 degrees definitely warrants a surgery in order to prevent further progression. If you're seeing at a particular age, like say around 12 years, you're seeing a curve which is almost already 55 to 60 degrees, there's a high chance that the curve can progress and then we need to intervene. Again, hunchback surgeries, which we call as kyphosis, is common in children as well as in adults. With children, we have different types of kyphosis that happen. In adults, it is mainly because of the degenerative thing that happens. And so these conditions, of course, again, warrant surgery. Coming to the last one, in India, considering the amount of road traffic accidents that happen, any traumatic scenarios wherein there is some sort of spinal cord damage, and you are expecting that might worsen, if it is an unstable fracture, if it is an unstable sort of a situation, we have to definitely intervene ASAP so that we can restore the normal alignment of the spine, make the person get back to his legs and to lead a normal life. So these are the conditions. Chronic low back pain, in general, there is no evidence that it requires any sort of surgical intervention. Any chronic low back pain, that is, we don't understand the cause. See, when we see a patient, we try to get an X-ray, we try to do an MRI, we try to evaluate with few other blood tests, and despite doing all this, if we aren't able to find the exact cause of the strain, then intervening, saying that, okay, I will try doing a fusion surgery and this might help for a chronic low back pain, is absurd. There is no proper evidence that claims the same. Okay, so now what are the advantages that we have in spine surgery over the past 1 or 2 decades? What has happened from where it was, where it is now? The instrumentations, the screws and the cages that we use these days are much advanced from what it was during the earlier days. We have come to a stage where we do a lot of minimally invasive surgeries where there is less muscle damage, less bleeding, and less chances of infection. Earlier, when you do a spine surgery, it is like the patient has to be in the hospital for 10 days, 15 days, nothing of that sort. So these days we have started doing daycare procedures where the patient comes in the morning, gets the surgery done, gets discharged in the evening, max to max 1 or 2 days. Even in the biggest of the biggest surgeries, we are able to discharge in 2 to 3 days time. So that's because of the advancement. Also, the thing is, like, we are able to do what is called as intraoperative neuromonitoring, which is in real time, we are able to understand what is the condition of the spinal cord, being the motor power or the sensory power. When I say motor power, the power of the muscles in the limb that you are able to move against gravity, and the sensation we are talking about is the sensory system. So we will be able to evaluate both during the time of procedure so that we'll get a live feedback and we'll know in case if we are making some mistake during the procedure, we will be able to correct it then and there. So that's one good advancement that's there. And then what is happening is the artificial intelligence. When we talk about artificial intelligence, it is combining that with robotics. So earlier days, what happens is like we used to, after we fix a spine by fixing it with screws, then we'll have to place a rod according in order to align for the spine. So earlier days, we had to just keep doing the alignment by ourselves by just bending the rods and getting it straight in order to match with that of the spine. But these days, we have what is called as AI helps us to pre-bend the rods prior to the surgery based on the CT scan of the particular patient. Also, when we have to operate on deformed spines, wherein we are not knowing the exact anatomy, that is, the anatomy gets distorted either because of a deformed spine or when a patient has already undergone another surgery, when we call it as, what we do is a revision spine surgery. So we are not sure where exactly is the normal alignment of the bone, whether we should put the screws exactly in that position, whether it exactly fit into the bone, or is it going to go inside the spinal cord and hit the nerves or something of that sort. These things can be handled much better with robotics. So when we say robotics, it's not the robot which is going to do the job. It's the surgeon who is going to 95 to 100%, it's going to be the surgeon who's going to do. But the robot helps us to plan so that we can have as much as 99% accuracy in the surgery that we are doing. As general public, you people would have got a clear-cut, basic idea about what spine surgery is all about, when to consult a spine surgeon, and when a spine surgery needs to be done.